had the opportunity to work with families before they even stepped through my door as a pediatrician, we would have such healthier kids.
Before trying to conceive, what are ways a woman can optimize her fertility, which will impact health of baby?
It's not just about mama, it's about papa too. Psychological stress can cause as much disruption to our microbiome.
Can you talk about what epigenetics is?
Epigenetics is really the idea that despite the set of genes that we are born with, we can change what influences our genes to turn off or on.
How does somebody even know if they need to optimize their microbiome?
Low zinc levels in mamas can increase the risks of things like ADHD for your babies.
Hi, I'm Ronit, WeNatal co-founder. Today I'm interviewing Dr. Eisa Song, renowned integrative pediatrician and author of Happy Kids, Healthy Kids. We dive into everything epigenetics. Dr. Song shares some pearls of wisdom, like how nutrients like zinc can impact issues like sensory processing. You're not going to want to miss this episode. It has so much actionable information that you can take and create a better life and a better blueprint for your children. I am so honored to have you here, Dr. Song. I have been a fan of your work for many, many years, and I am so excited to pick your brain on everything optimizing for a healthy pregnancy and optimizing during pregnancy for healthy baby, because it's such an important topic. So welcome to our masterclass.
Thank you. I mean, this is one of my favorite topics to talk about, because if I had the opportunity to work with families before they even stepped through my door as a pediatrician, we would have such healthier kids. And so I love this opportunity to speak about this.
Amazing. And I feel like because of this mutual love, we're like totally on the same page, and I'm excited to dive in. So let's get started. Before trying to conceive, what are ways that a woman can optimize her fertility, potentially? What are areas that they can look at within their own like diet and lifestyle, which will impact health of baby, which will impact pregnancy outcomes?
Yeah, there's a couple of things, and for me as a pediatrician, I'm always looking at how do we enter into pregnancy in the optimal health so that we can have the healthiest pregnancy possible to have the healthiest baby possible. And, for moms and dads, hopeful moms and dads listening, it can be so hard to slow down when you're on this journey and feeling like, oh my gosh, I need to rush, and try to get pregnant right away. But in that moment, the best thing you can do for your pregnancy chances and the healthiest baby possible is to slow it down. And I would love every family to really have at least 6 months before trying to conceive to get the maternal and paternal health optimized. And it's not just about mama, it's about papa too. And one of the best places to start is with the microbiome. The health of the gut microbiome that babies kind of enter into this world with and develops in the first few years of life, those kind of mythical first 1,000 days, really sets the foundation epigenetically for a baby's healthy immune system, healthy brain development, mental health, and even future hormones. And we're finding more and more research that it's not just mom's microbiome, it's actually dad's microbiome too, that really impacts pregnancy outcomes and baby outcomes. And so if you take the time to optimize your gut microbiomes through diet and lifestyle, doing targeted testing if appropriate, that actually will help to clear the way to really have the healthiest birth outcomes and baby outcomes possible.
I love that. You said so much there. So let's go one by one. First of all, optimizing microbiome in both mom and dad.
Hmm.
When I think microbiome, I think sauerkraut, I think probiotics, I think kimchi. What are ways that one can optimize their microbiome, or how does somebody even know if they need to optimize their microbiome?
Mm. Okay, so that's probably an easy question because probably all of us do.
Mm,
I mean, just living in our modern world with all of the forces that are really present that disrupt our microbiomes on a daily basis, it's a constant work in progress. And when we understand that your baby's developing microbiome influences their risks for either healthy immune development or eczema and asthma and allergy, or their risks for healthy brain development or
mm-hmm.
future problems with anxiety or ADHD or behavioral concerns, then we really can help prioritize all the things that we need to do to support a healthy gut microbiome. When we think about the things that disrupt our gut microbiome, the first step really would be to try to minimize those disruptors,
Yeah.
right? One of them is environmental toxins. So, environmental toxins, it's so interesting. Many parents are really familiar with the term hormone disruptors or endocrine disruptors, like plastics, bisphenol A in food containers, parabens that may be in our cosmetic and skincare products, forever chemicals that are in our yoga pants to,
Yeah.
cookware and to furniture. And those chemicals are also known to be microbiome disrupting chemicals. And that may be one of the reasons why they just really cause all of the havoc that they do. And so taking the time to um, clear as much as you can the toxic exposures in your household and in your foods is one very important step to optimizing your gut microbiome. Another disruptor that a lot of people aren't aware of is psychological stress.
Mm-hmm.
And psychological stress can cause as much disruption to our microbiomes as any environmental toxin or ultra processed food or antibiotics, even. And so, really taking the time to work on identifying how to manage our stress in an efficient, productive way, learning how to engage the gut mind body connection will do so much in actually supporting a successful fertility journey, in supporting actually your baby outcomes, because they've also found that um, supporting mothers prenatal psychological stress can help to support babies epigenetic potential for future chronic disease or not, including things like metabolic diseases and heart diseases, and also, of course, their own stress response. So, working on that, and I love that. I think that is such a priority, and it's something that a lot of parents in our world where we're trying to rush, 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 and maybe in this kind of feeling this emergent, fertility journey ahead of them, working on that piece is so powerful.
It's so powerful to arm yourself with all of these things before having baby,
Mm-hmm.
because these are all the things that you want and need when you have this like beautiful fresh baby in your
Yep.
household. So anytime we talk to couples who are trying to conceive, and we share the exact same things when it comes to diet and lifestyle and kind of stress management, the mind body connection, um, we always say, like, these are all things that you're not going to regret implementing in your house,
Yes.
because when you do have this beautiful baby in your house, you're not going to want toxic products around. You're not going to want plastics around and these forever chemicals. And also, I think that the journey of pregnancy just is always stressful because of just like our medical model, and you will always encounter things that are stressful. And for me, in both of my pregnancies, I had really high anxiety, and
Yep.
I'm not an anxious person at all.
Mm-hmm.
And I would have a really hard time sleeping. So I would literally be like, what do I do? What do I do? I need to download like a meditation app. Like, and I called myself like an SOS meditator. And it's just like so great to be able to have the skill set before you get pregnant, so that when you do encounter challenges, you have the arsenal that works for you
Yep.
to manage and navigate
Yeah.
stress.
Well, and also as a mom and as a parent, really learning how to use those tools when you need them also is supporting your child in watching you and
Yeah.
modeling that, okay,
Yes.
when life gets a little crazy, this is the time to slow it down, practice your breathing techniques, your mind body techniques, whatever tools work for you, as you said, and then your kids can find the tools that work for them too.
Yeah.
So it is about laying the foundations because let's face it, once a baby's born, there's still going to be a lot of stress and
It
struggles. I mean, there's
gets
beauty,
doesn't
but
get
there's a
easier.
lot of chaos.
A
Yeah.
lot of chaos. The other thing that I love that you said is that it's so many people are like, okay, we got married, we want to have a baby like yesterday. It's go time.
Mhm.
And we talk a lot about this pre-pregnancy phase as this golden
Mhm.
opportunity that both mom and dad have to give your child the best possible outcome in lifelong health. It's not just about getting pregnant, it's about creating the foundation for a healthy pregnancy and a healthy life. And when I was 41, after I had my miscarriage, I consciously didn't try for 3 months.
Mm.
And I think a lot of, fertility doctors would say, like, come on, like the clock is ticking, you're 41, like you just need to like try, 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 try. And for me, I was like, I would rather take care of my body, my husband take care of his body, and then try. And we did after 3 months. And we got pregnant with Emma, who is turning 4 in a couple
Yeah.
of weeks. So I think it's such an important thing in our culture of
Mhm.
like, rush, rush, rush to be so much more conscious about having babies.
Yeah. Well, and you hear that story all the time of the stress and the rapid pace and the urgency. And then when you can take that away, space opens up,
Mm-hmm.
your body opens up. And I mean, I had a similar experience. I mean, both of my babies were IVF babies, and I felt the same kind of go, go, go. Oh my gosh, we're getting older. And with Kenzie, we were pregnant first and miscarried at 20 weeks. And it was
Mm.
really so challenging. But all the doctors were saying, you have to keep going. You have to keep going. You know, you're over 35. And at the time, I was 37. And and so we kept trying, but something just was in me that I just could never complete the cycles.
Yeah,
So we decided to take a break. And then when we came back to it, our first round, it worked,
it worked. Yeah.
right? And so, you know, and that's not going to necessarily be the story for everybody, but life will give you the space if you open up the space.
Yeah.
And, you know, the thing too with modeling for our kids, you know, when we think about um, you know, the mindset piece, there's also, you know, as we think about diet and lifestyle, it's so fascinating because a lot of parents will note, and we have this experience too, that the foods that they crave during their pregnancy, their kids crave, right?
Mm-hmm.
My son is a complete carnivore. And when I was pregnant with him, all I wanted were steaks and hamburgers all day long.
Wow.
With my daughter, she loves fruits and leans more towards the vegetarian side. And the only thing I wanted were smoothies when I was
So
pregnant with her,
interesting.
right? But one of the things that we know is babies actually, their first taste is really your amniotic fluid. It's fascinating.
Mm.
And we can see babies in utero start to swallow more when moms eat something a little on the sweeter side, right?
Wow.
And there are studies showing that there was one study that looked at moms telling moms to eat a lot of carrots, basically carrots and carrot juice, in you know in the third trimester, and those babies who were born from those mothers who were told to have more carrots actually were much more receptive to carrots when they were born, when they first tried
Wow.
solids. So what we would like our children to eat when they are out in the world, we should start eating in that way when
Yeah.
we're pregnant for their future, but also really from an epigenetic standpoint and from a microbiome standpoint, because we know all the ways that we talk about, you know, the way to nourish our bodies with the whole foods rainbow and, you know, really minimally processed and unprocessed foods, those foods contain the epinutrients, those phytonutrients that will help your kids work for them, their genes work for them,
Mm-hmm.
will also help support a healthy microbiome, a gut microbiome and a vaginal microbiome for you so that your baby can be born with the healthiest start to their microbiomes. So we really want to think about, you had asked, well, what kind of foods? Well, it's really comes down to, I call them our microbiome champions, right?
Mm-hmm.
Your 3 Fs. So fiber, phytonutrients, which I know is a PH, but it sounds like an F, and fermented foods. So
Mm-hmm.
those three, when we think about where they come from, those are plants, right? They're
Yes.
all plant-based foods. And we have to think beyond the classic fruits and vegetable rainbow and really think about the whole gut supporting rainbow, which includes our tan colors, which are mostly our legumes and our nuts and seeds and our whole
Mm-hmm.
grains, which are packed with fiber. But the more fiber and phytonutrients that we can get, and even fermented foods, what's fascinating is that actually supports us clearing out and reducing our own absorption of endocrine disrupting chemicals and forever chemicals. And it
Yeah.
supports our ability to really create an anti inflammatory, nourishing environment for our baby when they're inside us.
I love that. So you talked about these phytonutrients turning on and off genes, which sounds to me a little bit about like epigenetics,
Mm-hmm.
right? So can you talk about what epigenetics is?
Yeah. So epigenetics is really the idea that despite the set of genes that we are born with, right, we can't change our genes. However, we can change what influences our genes to turn off or on. Now, one mechanism that is probably the most well studied mechanism is called methylation.
Mm-hmm.
And methylation occurs when there are certain nutrients like methylated B12, folate, choline, vitamin B6, betaine,
Mm-hmm.
all the nutrients that are so well studied in the WeNatal products,
Yeah.
right? Those support healthy methylation so that the genes that are going to be supportive of health are switched on or off in the appropriate way. And we
Mm-hmm.
know that healthy, proper methylation sets the stage for healthy immune system functioning, healthy cardiovascular health, healthy metabolic health, healthy mental health. And so when we can provide those methylation support nutrients in utero to our babies, we're setting the stage to have their genes work for them for the rest of their lives, which is
Yeah.
fascinating. So even if something, quote, runs in the family,
Mm-hmm.
those genes don't set your health destiny in stone. It's how we allow our environment to interact with our genes that really sets the stage for what kind of health outcomes we're going to have.
Yeah, I love that. And I think when I fell in love with functional medicine is when I learned the concept of um, your genes load the gun, but your environment and lifestyle pull the
Mm-hmm.
trigger. And I was so blown away by that concept because for years and years, we're like indoctrinated to think about, like, oh, well, this runs in my
That's
family.
right.
And it's just like you just accept it. Like it just runs in my family to have eczema or to have asthma or to have, all of these things. But no, it's actually like what we do in our diet and lifestyle while we're pregnant and like when children are young and just throughout our lives.
Yeah, yeah. I mean, it's fascinating because even in identical twin studies, right? Identical twins. I have an identical twin, right? And very same genes. So you would think that if your genes set your health future in stone, that twins would always have the same diseases.
Mm-hmm.
But it's really for most diseases, there's what's called a concordance rate, meaning a similar disease rate, maybe about 50% of the time. So what
Mm.
does that mean? Sure, if something, quote, runs in our family, we may have a
Disposition.
predisposition, right, to anxiety or autoimmunity or eczema. But that other 50%, we have control over. And I love that because it takes the power, it gives us back the power,
Yeah.
right? And it gives our kids back the power to say, look, all right, just because this runs in the family, I'm not just going to lay there and let this happen to me. I'm going to do anything I can to be proactive. And guess
Mm-hmm.
what? Those things that I do proactively are going to make me feel great,
Yeah.
right? They're going to make my body and my brain and my immune system work incredibly well for me.
Yeah. I love that. At WeNatal, we always talk about the nutrients that kind of are in our supplement that can impact baby outcomes. So, like
Hmm.
for instance, choline is a big one, which we know we get from like egg yolks and liver, but and we know that impacts cognition.
Yep.
And we know that omegas can impact baby brain development. You talked a little bit about some other nutrients, and I'd love to hear some of those, like women who are low in vitamin D, for
Mm,
instance.
yep.
What does that look like as far as their outcomes of children, and how is that correlated with different kind of conditions that we're seeing in
Yeah.
kids?
Well, some of the nutrients, like you mentioned, choline, so important for, again, methylation support. But, the studies are so compelling with the need for high doses of choline when you're pregnant for optimal
Mm-hmm.
brain development in babies. And I would say those studies are probably some of the more compelling ones. Um, as far as other nutrients, we know that low vitamin D levels in mamas when they're pregnant can increase the risk of neurodevelopmental concerns in babies and children. Same thing with low zinc levels. Low zinc levels in mamas can increase the risks of things like ADHD for your babies. And so
Mm-hmm.
optimizing all of those nutrients. And if you have the opportunity, from a functional medicine standpoint, there's a saying, test, don't guess. So
Mm-hmm.
having that opportunity to test and, more and more, um, I would say nowadays, when I look at labs from pregnant moms who are coming to see me, um, I will see a vitamin D level checked. However, what I encourage moms to do is not just accept that, oh, it's a normal vitamin D level, but to ask what that vitamin D level is. Because,
Always
yes,
ask. Don't just trust what they
that's
say
right.
and don't just trust the ranges. Look at it yourself.
Yeah, because there's a complete distinction between what's quote normal for your average population. And let's face it, the average population nowadays isn't all that healthy
Mm-hmm.
versus what is optimal. And so for instance, at Quest, a normal range for vitamin D is anywhere from 20 to 100. So if
Mm-hmm.
your doc says, "Oh, you have normal vitamin D levels," and you're at a 21, well, that's certainly not optimal for
Yeah.
you or your baby. So
Yeah.
really trying to get your vitamin D levels up to I typically want my moms and children to be up at 60 to 80.
60. Yeah.
Mhm.
Yeah.
And same thing with the zinc level. So and zinc for babies and is so important for their nervous systems, their immune systems. Um, Iron, the most common deficiencies that we see in kids, infants, kids, teens, are very similar to the most common nutrient deficiencies in adults: vitamin D, iron, zinc, magnesium, right?
Magnesium.
And
Interesting.
omega-3 fatty acids, right?
Mm.
And so those five, really making sure, and we can check blood levels of all of these. So making sure that they're optimal. Not only will you feel better during your pregnancy, right? And your mood will be better,
Yeah.
but your baby also, your baby's development in utero will be optimized, and also their outcomes when they're toddlers, kids, and teens will also be better.
Yeah, we always say that the best way to prevent postpartum depletion is to kind of build your nutrient bank account in the preconception time frame because babies will take what they can out of you, and
Hmm.
sometimes there's not even nothing for the baby to take. But it's so these nutrients are so powerful, and in fact, I heard you talk about zinc and its relation to sensory processing,
Yeah.
And Vita's daughter has like kind of like low level sensory
Hmm.
processing, and she started putting zinc in her water bottle, and it's completely gone away.
It's fascinating. This is a pearl that I've learned clinically over time, and some of the research is bearing it out too. That low levels of zinc can really affect your taste perception, right?
Mm.
Our kiddos who have quote picky eating, increasing their zinc can really help to open up their palate. But other sensory issues, like my son, went through, and he still goes through periods where his clothes don't feel quite right, or
Mm-hmm.
his socks just really bug him, or his shoes can't be tight enough. And so those are the times. And he's 13 now, and he actually will say, "Hey, mom, I think I need more zinc right now," because he
Wow.
knows how much it helps him, especially when life just seems to bug him, you know. So, and that is something too for us. I mean, we as adults, we all go through times where the tag on our shirt bugs us, even though we've worn that same sweater 100 times before and it didn't bug us before, you know.
Yeah.
So, and zinc is also really important for neurotransmitter production and so important for immune system functioning. So, those are the things I love that you say build up your nutritional bank account before you conceive, because it is true. We are designed as women to, be nurturers for our babies when we're
Mm-hmm.
pregnant and when we're nursing, and oftentimes at our expense,
Yeah.
at our depletion.
Yeah.
There's even, women who are very malnourished. Their breast milk typically is of the same nutritional value as
Wow.
as a well-nourished woman, because everything is getting taken out of her.
Yeah.
So, and that is something too, but after I had Kenzie and we were ready to start to try to have Bodhi, I remember checking all my blood levels again. I had been taking vitamin D supplements my entire pregnancy, the entire duration of nursing. I was floored that my vitamin D level was only 27,
Wow.
because everything was coming out to
Yeah.
support Kenzie,
Yeah.
right? Which I wouldn't have it in any other way. But if I had checked beforehand and realized I was so low,
You would have
I
supplemented
would
with
have
more.
supplemented more, and maybe that would have helped my postpartum anxiety that I had,
Yeah.
right?
Yeah. And vitamin D is also an interesting one when it comes to like different conditions like gestational diabetes and
Mm-hmm.
even preeclampsia.
Yep.
With Emma, I had preeclampsia, and I also had no idea that I had low vitamin D. And after the fact, when I learned that it was associated with low vitamin D, I like couldn't believe it. And actually, it's one of the main reasons why WeNatal has 4,000 IUs of
Yes.
vitamin D, because 1,000 IUs is not enough.
Not enough.
And 4,000 is kind of like where we see is
Hmm.
optimal for pregnant women.
I love that. I love that because that is, it's so true. Babies are advised to get 400 IUs a day, and then when they're older, 1,000 IUs, and then that's kind of the cap for a lot of doctors what they recommend. But 1,000 IUs in our modern world is just not going to be enough to support hormones, metabolism, brain health, immune health. Vitamin D is one of the most important nutrients that we have to really support all of our body systems, and so
Mm.
optimizing is so key. And I love that WeNatal has really optimal doses, not just the bare minimum.
Yeah, so let's talk about that. So baby is born,
Hmm.
and then do you recommend giving? Because I know there's like this debate of like vitamin D, no vitamin D for baby, like in the milk, not in the milk. What are your thoughts on supplements for newborns?
It's interesting because the American Academy of Pediatrics recommends that breastfed babies get 400 IUs of vitamin D daily, but not formula fed babies. So, why is that? Well, because breast milk really evolutionarily should be the perfect food for
Yeah,
babies, right? But it's really, I think, mostly because most breastfed moms are
are
deficient,
depleted.
right? They're depleted. So if we can optimize, if you know you have optimal levels of vitamin D, your baby probably doesn't need extra supplementation,
Yeah.
but I typically do supplement babies, with a little vitamin D. Unless, of course, now most of the mamas who are in my practice, we know what their vitamin D levels are, and we've optimized mom's vitamin D levels. Now, it's interesting too, the recommendations for first foods for babies
Mm-hmm.
has also shifted a bit. Now, one of our first foods for babies is recommended to be animal proteins
Yeah.
because most babies are found to be deficient or insufficient in iron and zinc levels.
Mm.
And both iron and zinc levels tend to be highly correlated with animal protein intake. Now if you are vegetarian, you can absolutely increase your levels of both, but you have to be a little more mindful of
Yeah.
it. But that's where, again, if you're nursing and your levels of iron and zinc are optimal, then your babies likely won't reach that low point in their iron and zinc levels and can really, not necessarily need supplementation and can get a lot more from their food.
It's such an important point that you're making with a postpartum because oftentimes, once a woman becomes postpartum, baby's born, all the focus is on baby, and mom forgets to take care of herself, or it's like the prenatal is like done, you don't need
Yeah.
it anymore. But we say it's so important to continue taking your prenatal in the postpartum
Oh,
stage,
yes.
for sure, while you're breastfeeding, but then also after the fact to replete all those nutrients.
Yeah, that's absolutely. Especially if you are also future thinking about having another
Yes,
baby, right? So we
exactly.
need to make sure that our nutrients remain optimized for ourselves and also our current babies and our future babies.
And what about like probiotics for newborns? And specifically, I'm thinking about the moms that have tested positive for group B strep
Hmm.
and have had to take antibiotics during their labor. What are your thoughts on that? Because
Yeah.
obviously you want to build a healthy microbiome from day zero.
Yes. So we know that vaginally birthed breastfed babies tend to have different microbiomes than C-section born formula fed babies or babies who were exposed to antibiotics during the delivery.
Mm-hmm.
And those babies whose microbiomes are set in the setting of either a C-section birth or formula feeding or having received antibiotics tend to have microbiomes that increase the risk for allergic conditions like eczema,
Mm.
asthma, food allergies, hives, even for babies who received antibiotics in the first 6 months of life for other reasons. Let's say either a urinary tract infection or maybe an ear infection.
Mm.
We know that that also increases the risk of allergic diseases by the time kids are 4 years of age. And so, understanding that for those babies who have those risk factors, I do recommend supplementation. I'd like to be even a little bit more targeted and do some microbiome testing even on babies if possible, right?
Mm-hmm.
Because we know that babies' microbiomes look very different than adult microbiomes, and infants until around the first 2.5 to 3 years of age really require almost exclusively bifidobacteria uh, probiotic strains.
Mm.
Um, Now, what about your vaginally birthed, no antibiotic breastfed mom? Do those babies require any probiotic supplementation? Maybe, and a lot do. What's really fascinating is when we look at the microbiomes of babies, there was a Scottish pathologist 100 years ago who looked at baby poop.
Oh.
And there was even infant formula back then. I mean, I'm sure it looked way different than our formula, but he looked at the microbiomes of breastfed babies compared to formula fed babies back then, and the breastfed babies had almost 100% bifidobacteria species.
Wow.
We don't want a lot of microbiome diversity in babies. Compared with older kids and adults, we do want a lot of diversity.
Mm.
And the formula fed babies had more diversity, they had different microbiomes. What's fascinating is that the breastfed baby of today, their microbiome looks much more like the formula fed baby's microbiome of 100 years ago. So things have shifted. Our
Mm-hmm.
modern life has shifted our microbiomes and
Interesting.
shifted even our adult microbiomes. And so, probably most babies could benefit from um, microbiome support. Now, whether that means um, probiotic supplementation or likely also, maybe even more importantly, prebiotic supplementation.
Mm.
So, the nutrients and the food to help those beneficial flora to grow and thrive.
Mm-hmm.
And breast milk is chock full of amazing prebiotics called human milk oligosaccharides or
Mm-hmm.
HMOs that support bifidobacteria. And
Mm.
now there are commercially available some HMO
HMOs.
supplements for babies, which I think would be really amazing for probably virtually all babies.
Interesting. I love this. It's just so fascinating, all this like microbiome work and like the impact of microbiome on health. Um, you shared a little bit about the link between kind of a disrupted microbiome and eczema
Hmm.
and
Mental health concerns
mental
too.
health and just like skin issues. Gosh, you see these like really beautiful children with like red all over their
Yeah.
face.
Yeah.
How does, if somebody is already like at that point,
Hmm.
what are your thoughts? Like, what is this? Do you start with a microbiome? How does a parent navigate like a few years down the road? Okay, like they had the antibiotics,
Yep.
they had the C-section, they had to be formula fed. What's next for those kids?
Yeah. And so it's such an amazing point that you're making. And I always tell moms because once you know that how important the microbiome is, a lot of moms will go back in time and think, oh my gosh, I wish I had known.
Yeah.
Right? Like I wish I'd known that the antibiotics at, when my baby was 4 weeks old or 4 months old could set the stage for future eczema or anxiety or whatever it is. We only know what we knew at the time,
Yeah.
right? And what's really important is that parents know now.
Mm-hmm.
And we can always support and heal a disrupted gut microbiome.
Mm-hmm.
Sometimes it takes more work than other times, but we can always do that once we know that there's a problem, right? Because a lot of parents whose kids have eczema or whose kids have anxiety, they have no idea to look at the gut microbiome.
Mm-hmm.
But when you do know and you realize the power of optimizing your gut microbiome to kind of course correct the immune system dysfunction that's occurred or the disrupted gut brain connection that's occurred, then we open the door for so much healing. So yeah, we always really look at the gut microbiome, try to optimize that. That can include microbiome testing. um, it can be very helpful to do stool testing because sometimes we don't know what's deficient or insufficient or too high without looking.
Yeah.
I mean, I can't look at you. I can look at a child and suspect, oh, maybe they have some zinc deficiencies because of the sensory issues, or
Yeah.
they probably have some need for extra vitamin D because you're getting sick all the time.
Mm.
But I can't look at a baby and say, oh, they have too little bifidobacteria, or oh, maybe they have too much Klebsiella. That is really helped by a comprehensive functional stool analysis. But apart from that, if your baby or your child has had antibiotics years ago and now you're thinking, I wonder if they're disrupted, maybe that's why they're suffering with you know the rough bumps on their skin, or as a teenager the horrible acne, right?
Mm.
Yes, absolutely, it's very likely playing a role. And so I help walk parents through a gut reset protocol, and it's outlined in my book, but it's also something that I do in my practice. And so part of that, the reset, right? The RE in the reset means returning to all the things that create microbiome magic. And it's
Yeah.
all of the diet and lifestyle factors. We have to have that foundation because I can suggest all the supplements I want for your child, and maybe their eczema will heal, or their ADHD all of a sudden is so much better. But without the foundations,
Yeah.
their gut microbiomes are going to slide right back at some point, right?
So the foundation of that I read in your book is obviously like big time diet. What if you're dealing with a picky eater?
Hmm.
Let's talk like just this is like practical
Yeah.
for parents. So many kids have this like picky eating phase. And I had, my first, she had a phase of picky eating. Thank God she's out of it because, of course, like at home, we model healthy eating. And I'm proud to say that, like at school, when people ask her what's her favorite food, she doesn't say pizza, she doesn't say hamburger, she says salad.
Nice.
So I'm very proud of that. But my little one is still in this like picky eating stage. She's 4 years old.
Hmm.
And I know that it's just a matter of time until she like grows out of it because as like a baby, she ate everything
Yes.
from sardines to liver to like literally anything and anything I gave her. So what do you do when you're in that like picky phase?
So the first thing that we need to do when our kids are in that picky phase, and parents will have this experience where one kiddo is this amazing, varied eater, and they're doing the same things for their next kid, but it's a little different. But the first thing as parents that we want to do is really not set up any power struggles because
Yeah.
that's really gonna backfire, and just really like you're doing in your family, just modeling.
Mm-hmm.
Right, really modeling, encouraging, praising, getting your kids in the kitchen involved, no matter how old they are,
Oh,
right? Even if they're a baby, you could help, they can help kind of put their
yeah.
fingers into the kale and kind of help massage the kale, even if they don't take a little bite. But kids are so much more open to at least a little taste on the tongue if you've
Yes.
involved them in planning out the meal, going grocery shopping,
Yeah.
um, you know, prepping the vegetables or fruit in whatever way you can, and helping you make the meal. Now that it doesn't have to be every single meal, because I know
Yeah.
for busy moms, sometimes you're like, I just need to get food on the
Yeah.
table, right? So don't do it when you're busy and harried and everyone's hangry, but take the time to really, teach your kids to enjoy being in the kitchen,
Yeah.
right?
I think that's such important advice.
The other thing too is just remembering that it can take, 30, 40 times
Mm-hmm.
of exposure to a food to find it acceptable. So having patience, keep trying. And if you know that your kids, have certain texture preferences, then work with that. In the book I
Mm-hmm.
talk about, same fun, different yum, right?
Yes.
So really trying to work with if your kids really like crunchy foods, right? Then and let's say they really like crunchy, I don't know. I'm going to say French
French
fries. All right, I'm going to
fries.
say
I
French
mean, who
fries.
doesn't?
That's right. So instead of then thinking, oh, they're going to go for a bowl of mashed sweet potatoes, that's a completely different texture,
Yeah.
right? So don't go for that. Maybe try some, cut jicama, right?
Mm-hmm.
With which is really crunchy, or go with the parsnip fries
Yeah.
or the sweet potato fries, and
Yeah.
just a similar texture, just a slightly different flavor,
Yeah.
right? And if your kids are, let's say they like broccoli, which is a vegetable that most kids tend to find that they like, right?
Yeah.
So even a different color counts towards supporting your microbiome and your immune
Mm-hmm.
system and brain in a different way. Remember those phytonutrients. Each color represents a different
Yeah.
phytonutrient. So if your kids love broccoli, well, go to the farmer's market and see, do they have purple broccoli,
Mm-hmm.
right? Or do they have, if they like bell peppers, get all the different colors of bell
Mm-hmm.
peppers, and just trying to make it as um, fun as possible, and working with where they're at and just
Yeah.
making little micro changes, not huge changes.
Yeah. With Eden a few years ago, we went to the farmer's market and there were all these colors, beautiful colors of cauliflower,
Oh, I love it.
literally purple.
Hmm.
There was Romanesco, so I classified that as a cauliflower. And then I said to Eden, like, let's buy all of these and
Yeah.
make a rainbow
Yep.
cauliflower. So she helped me put it on the pan as like a rainbow. And like, that was like her first time eating cauliflower.
Love
And I
it.
was so happy.
Yes.
And yeah, so I think all of these are
Yeah.
such great suggestions, but I do agree getting them in the kitchen is the number one way to get them to try things.
Yeah. And sometimes they will need some supplements,
Yeah.
right? I mean, for your really, kind of pickier, sensory kids, like I said, the zinc can be really, really helpful. Sometimes just supporting their gut, with prebiotic supplements and probiotics can also help to expand their palate. Because what's
Mm-hmm.
fascinating is that the microbes in our gut can actually communicate with our brain and make us crave different foods.
Yeah.
And so our flavor preferences can be dictated by our microbes and not necessarily our own innate preferences. If we have a lot of yeast overgrowth, that often will cause sweet and sugar
Sugar.
cravings.
Yeah.
So we handle that, and then all of a sudden it's easier to manage all of those sugar
Mm-hmm.
cravings.
Yeah. Oh my gosh, I love all of this, and I could talk to you for hours. Your book is incredible. Tell us about your book and where people can find you.
Yeah. So my book is called Healthy Kids, Happy Kids, an Integrative Pediatrician's Guide to Whole Child Resilience. And you can find it pretty much anywhere books are sold. I actually got a text from one of my friends who is a pediatrician in Florida, and she was visiting her family in Bulgaria and said, I found your book in a local bookstore in
Ah,
Bulgaria. So we always want to support our indie bookstores if we can.
mm-hmm.
But of course, on Amazon, it's available, Walmart.com. It's a book designed to be a comprehensive manual for you.
Yeah,
So the first part of the book really explains why your child's microbiome is so important for their developing brains, bodies, and immune systems. The second part of the book goes into, um, you know, how our gut microbiomes really can be optimized with
mm-hmm.
the 5 things for microbiome magic. So, how we're eating, how we're breathing or engaging our vagus nerve, how we're moving our bodies, how we're hydrating, and how we're sleeping. So, all the things that we do every single day. Anyway, I'm not
Yeah,
asking parents or kids to add one more thing to their busy
yeah.
schedules. I'm just suggesting if we do them mindfully in a way that really supports our microbiomes, we're all going to be so much healthier for it as a family. And then the third part goes exactly into, well, what if your kid's microbiome is already disrupted? How do we reset and optimize our microbiomes? And then the fourth part is maybe one of, I don't know if it's my favorite part, but it's a part that I think is so that parents really are lacking, is how do we use um, our natural tools, our natural
Mm-hmm.
toolkit, homeopathy herbs, acupuncture points, essential oils, when our kids are sick, so that
Mm-hmm.
we can hopefully avoid unnecessary trips to the ER and
Mm-hmm.
unnecessary antibiotics.
Such an important book for anybody who's trying to conceive, and I would say like that should be um, a must read for any future parent. And I love that you go into like the actual practical, how to read a food label, how
Mm-hmm.
to know how much sugar is in a product, realizing that we probably are all like overeating sugar because it's hidden in so many places. And when we talk about diet and lifestyle for fertility, you can really get all of that from your book. And I
Yeah, I
think
mean,
it's
it's
so
meant for the
important.
whole family, and it's meant to, as we educate ourselves as parents, um, and we teach and educate our kids to do the same, that helps set the stage for success when they're out of our homes.
Yeah.
Because we need to empower them. It's not just about,
A
mom wants you
hundred
to do it.
percent. 100%. And then the one last question I have is you talked about gut the stool testing, and I know that you're an advisor for a company called Tiny
Mhm.
Health. So is that's a consumer facing, people can just order that
That is,
online.
yeah. So Tiny Health has microbiome testing for the gut, for infants all the way up through, adults of any age, and also vaginal microbiome testing for
Mm-hmm.
women to really optimize their vaginal flora before baby's born as well. And the reason why I really stand behind Tiny Health is because they're the only company right now that has specific biomarkers for microbiome health at all ages. So for infants through the different stages, from the first 0 to 1 year of life to toddler years to kids and teenagers, because we are finding that microbiomes are different between males and females. Microbiomes are different through the ages, and we can't take an adult microbiome analysis and say, oh, we're going to make decisions for my 2-year-old based on that test.
Yeah.
We're also going to find, we are finding that microbiomes for women are different when we're in our younger kind of fertile years versus when we're in our perimenopausal and postmenopausal years.
Yeah.
So we want a test that can really support our optimal microbiomes no matter what age or stage of life we're in.
Yeah. Amazing. And where can people find you?
So the best place to find me is my website is healthykidshappykids.com, and I'm most active on Instagram, which is healthykids_happykids.
Amazing. Thank you so much, Dr. Song.